And the Ghana Registered Nurses Association says it wants the stimulus package announced by President Akufo-Addo for frontline health workers to cover every nurse and not only those exposed to COVID-19. As you heard Dr. Hineba say earlier, everybody, including those in the private sector, are all frontline workers in these times, because any patient at all can walk up to you. To get a better understanding, General Secretary of the Association, David Tenkran Chum, joins us via Skype. Mr. Chum.
Hello.
Thank you very much for your time this afternoon. Let's take a look at the groups. I mean, what's your understanding of what the president said? Do you get the feeling that it doesn't include people that you are referring to?
Good afternoon, and thank you for giving me the opportunity. Yeah, of course, the package that but we are of the view that it should end, because the definition of a frontline staff or a frontline healthcare worker is not limited only to the one who is directly taking care of the patient. Mind you, people come to the hospital or our facilities and they are asymptomatic. Now, that tells you that they pose a risk to everybody that they come in contact with. So what we are saying is that government should expand the scope of the frontline staff or the frontline workers to include every healthcare worker. So the risk is shared to all of us equally. You can find yourself in a chip center as a community affairs, and somebody can come to you as a subject and may pose a risk to you. A typical example is the lady that was discovered Upper West or Upper East, excuse me. A pregnant lady. It presupposes that perhaps she might have attended an antenatal, and a midwife has attended up. So the risk is varied. So the position that the information minister was seeking to posit, to me, is untenable. And we want, as government, to review the scope.
You want government to review the scope. Well, I will play back the president, perhaps, if we do get it, so we have an understanding whether or not in his announcement he restricted this insurance package to only people who are working directly with persons who have contracted COVID-19. But if that is the case, how exactly are you hoping to engage to get your concerns heard, for example?
Yeah, we want to seek further and better clarification. We think that, as we earlier on, all nurses and midwives, by extension, all healthcare workers are at risk. Now, I reckon the fact that those who are directly taking care of the patients can be compensated in a certain way. But you see, what people don't know, that when somebody presents asymptomatically but has the disease, poses considerable risk to the healthcare provider. If I know that you have the disease or you are suspected case, I know how to protect myself to render the kind of services that you require. But what about the one who comes and is not showing any sign and symptom? You have to meet the person, interact with the person before you get to realize that the individual meets the case definition.
Yeah.
Okay. In that process, you would have compromised yourself. What we think is that government should expand time. They can graduate it. Okay, so if you are giving 50%, those who are directly nursing these patients, we agree. But a certain percentage can go to every healthcare worker, from the nurse to the midwife, the matron, or anybody who works in the hospital, whether CHIP center or health center or a district hospital or a regional hospital. A case in point, what happened at Rich Hospital where 40 nurses have been quarantined right now, the patient did not end up at the isolation center. The patient was sent to the emergency unit. Can we say that those nurses that were at the emergency unit are part of the frontline healthcare workers or not? So that is our argument, and we think that government must look at it for the second time.
Right. Well, these are early days yet. President Akufo-Addo just made that announcement yesterday. And so hopefully, as you are hoping to engage for further clarification, you'll be able to get that further clarification, and perhaps we'll take it from there. But what has been your personal, before we go, what has been your personal experience in these COVID-19 times?
All right. We have gone around, interacted with some of our colleagues from the pre-triage area to the triage area, the admission centers, and some of the emergency centers. There's that kind of despondency. You don't have all the necessary equipment to work. We recognize that at various levels of risk. So you don't need a full PPE to sit at the pre-triage area. But at least the minimum protection or protective equipment must be available so that you can be confident enough to take care of the patients.
Mr. Tinkwan, thank you very much. This will be
for now.
Go ahead, make that point.
Yeah, as I said, the package is commendable, but I believe that it should listen to us, and that all we can pull together. It's not the time to, confusion or to be seen supportive or collaborative of government efforts, but it's appropriate that they listen to us and do what we are asking.
I'm sure they will listen. Like I said, let's keep this engagement going and let's see how it goes. Like I said again, here on this show, we have a segment that's totally dedicated to persons like yourself who are working out there in the health sector, reaching out to every sick person that comes who may or may not have COVID-19. And so be sure, be certain that your work is appreciated and it is not going unacknowledged. We'll certainly will have more of this conversation. This is not the last of it. We'll see what government response is to this request.